Bataringaya Basil. I'm the Member of Parliament for Kashar North in Barara District. And one of the centers is Bwezbwera Center, which is in my area. I'm the chairperson of the Ankwere Parliamentary Caucus. And therefore, I'm the one who has been coordinating between the Ministry of Health, the Association of Surgeons of Uganda, and the members of Parliament from Ankwere region. The members of Parliament are in their respective areas waiting to receive these teams. So me, I have chosen to come here and receive all the teams that pass here, and then I will go to receive my team in Bwezbwera. So as members of Parliament, we are contributing to this corporate social responsibility, but the major item that we are benefiting from are the brains and time of these people. So don't see them in shorts and simple jackets. You know, Africans, we know how to underrate. These are very highly trained people. Some are professors in here. Some are with those very high qualifications, you know, in the medical field. But now they are in their casual mood. But when they get their surgical equipment, that's when you know how serious they are. Their time of 7 days, free of charge to our people. Their brains for 7 days, free of charge to our people. These people charge in millions when you get them in their clinics. But they are going to charge us zero. Zero. I repeat it. They are going to charge us 0 shillings per day for 7 days. So we appeal to you, the media, to make sure that you propagate this information. It goes as far and wide as possible. Even people who are outside the Ankwere region can benefit if they are registered in these medical facilities. So it is not only for Ankwere regions, but it is based in Ankwere region, but it can serve any Ugandan who comes for surgery. Zoba twayakira abashaho abakugu abarukushemeza abantu. Abashaho aba nuba coordinating association yabo ya Association of Medical Surgeons of Uganda erikwebemberwa Professor Moses Garukande utakashikira hariyo nadumira abandi abariyo nibisha. Nekoragana hamwe na Ministry ya Health ibiri ne timu ejo ya Health nebemberwa Permanent Secretary Dr. Diana Atwine. Kandi side yitu ya Members of Parliament nebemberwa Chairperson wa Ankwere Parliamentary Caucus ogwariyo nagamba Basil Bataringaya. Nyenda kutwara umugisho gukwebaza aba Ministry of Health abasize byona na nabandu bona bariyo nibatuhereze mbazi nkaba Uganda Medical Stores. Nyenda kwebaza ba surgeons zaba nko kuwahurira okubagamba habo barikushemeza abantu nabo nyenda kubebaza. Nyenda kwebaza umuringo gwo mutano Right Honorable Deputy Speaker witu atwire motoka I think 13 za Costezi numwe mutakazirebera aha zo kutambuza abashaha babona omu region yitu ya Ankwere. Nyenda kwebaza ba member ba Parliament bitu abatambe njirire mutwe muhango mukuba coordinating ahabwo kuba umurumogu nkuko gureba tugorobi so nkuko nabagambira abantu abamuri kureba nkuko bajwire nkuko kuba kweza kutaho bere bya green nubwo murije kumanya ubukugu bwabo. So haturiyo mbantu bitu baburijo konka emitwe yabo nesigara eine echeyekorire ekikuza kuyamba abantu bitu kuruga umburwire obintu bateganisa. Mbwene ko murumo gwanyu ni mwenyenda kubebaza abamahurire kubebaza ntinde bugarukiro kandi ngarike mbashabe ngumwaruga murebeke ngu umurumogu mwagutwara mwagusyo mbantu abantu mwabashoborura abantu bona babasa kugira ki kwija bakakebeza kandi bakaraguza kandi bakija kare ubundi indwara zitakabateganisa. Tushaba nguna ni umwe media houses mutukorera kenso mugume no murabiya mwakarango ka buri kasheshe na buri mwebazi akatashashurirwe abo kubona ni tuturiyo tukora aba bariyo no batuhereza ubwire bwabo bwabusha na ni mu mutereze makire kanyu bamaneje abanyu mbagambire batuhe mwakire kabo ako kutuhereza ibirango bitashashuriri kwenda ngo abantu bitu chanceji itarabarabo nyenda kwendera kugira ngo hati timu zirurede nyenda kubashaba ngo buri umwe aze a station ye ya kurugira okubaka amabe baramuragirire uherezo bunko kuna abanagambe konka kampagambe hona district ni 13 konka a health center force na regional hospital na teaching hospital ya KIU Bushenyi. So nizezi kazo health center for Chiruhura Rushere community hospital na Chiruhura health center for Ibanda Ishongoro health center for Kagongo hospital hamwe na Ruhoko health center for Mbarara district Bwizibwera health center for Mbarara city Mbarara regional referral hospital Mbarara regional eye center and Mbarara city health center for Isingiro aro centers zito tebekanisa konka zaguma nko kuzibeziri Kabuyanda health center for Nyamuyanja health center for hamwe na Rugaga health center for Twaza Ntungamo Chitwe health center for hamwe na Itojo hospital hamwe na Rubare health center for Twija Rwampara Mwizi Rukarabo health center for Bugamba health center for hamwe na Chinono health center for Twaza Western Ankore Buhweju Nsika health center for Rubirizi district Rugazi health center for Shema Chitagata hospital Bushenyi KIU teaching hospital Adventist hospital hamwe na Bushenyi health center for Mitoma is Mitoma health center for there is only one and it's only one. Then we shall have schools which will also participate in this, which have been chosen. The schools have been chosen in Bushenyi and also Kazo. The schools, I don't remember them off head, but they are in Kazo and Bushenyi.
So, buhereza chona lebo. Buhereza choba
obuherezo bakuza kuhereza no kushemeza kwa buri muringo ambye nintekateka ngo nobwongo tubura umuntu obwo nabangira ngo brain surgery rumu hamwe ekitari mu nemituma. Are you doing heart surgeries? Heart this time no heart surgeries, but they will be assessed and referred. Baza ko basesinga barwire mituma baba referring aho kubakorera konka bine obuzibu abwongo na naharukizi abone bija kukorwa na nebindi goita haniya ishundo abakaza bari kutonya fistura nebindi nkebyo konka ebyo byona ne bari registered aha marwaro aho bakuza kukorwa so ko kikoba kwa sesinga waba registered then bakurufaringa owasajira.
We will also good evening ladies and gentlemen. Honorable Basil Bataringaya, and on behalf of your fellow MPs, the leadership of Mbarara Regional Referral Hospital, members of ASO, Association of Surgeons of Uganda, and our affiliate associations, especially Association of Nurses of Uganda, you members of the Fourth Estate, I want to, on behalf of Professor Moses Galukande, the President of Association of Surgeons of Uganda, I want to deliver our heartfelt gratitude, first and foremost, to our colleagues, members of the medical fraternity in this region. My name is Dr. Fred Bisso. I'm a senior consultant ENT surgeon at Mulago National Referral Hospital. We want to appreciate our colleagues, members of the medical fraternity from this region, for one, the service you deliver in this difficult terrain. The road reading here is good, but we know the terrain is challenging. And as a person who has worked up country for a long time, I know what it means to work in an area with a difficult terrain. But we want to appreciate you for the service you are rendering here. You are number 2 reason why we are here. Number 1 reason we are here is the citizen of this area. The lowest person of this area who might have been sitting on a disease that requires a knife to heal it. But for one reason or another, they have not been able to access that service for various reasons that you may know. So they are the number 1 reason we are here. And number 2, why I say our local team here is the number 2 reason, because number 1, we are here for service delivery. As they have already mentioned to you, our team comprises of surgeons of various specialties, some of which maybe are just coming on the ground or others are not on the ground. So as Association of Surgeons of Uganda, we agreed that every year we should have this ritual of a camp. I think we are doing it for now close to 30 years. We choose a region and we go to bring those services that our local people, the citizenry, cannot access locally. They would require them to travel hundreds of miles to go and access. We decide if Mohammed can't go to the mountain, then the mountain should go to Mohammed. So this time, the mountain has come to Mohammed because Mohammed could not go to the mountain. So, number 1, service delivery. Number 2, we also come to build the capacity. Every health facility that we visit and we work in doesn't remain the same. In which way? Number 1, before even we do the camp, we visit these facilities, we assess their capabilities, and where they are deficient, we start building capacity. For the last 3 months or so, we've been improving the capacity of these facilities. And during the camp, like now, we continue building the capacity of the local facilities via working together with the local teams who will be worked on where and when. There are centers which may not be able to handle certain cases that will be taken there. This team will guide them around. So our appeal to you, go and send the message. There may be people who have not yet received this information. But we are here, we're a very big group, very powerful team. I think we are close to 200 health workers who are joining the local team here. Tell people we are here to offer service. We will be working, and we prefer that people report early their operations which after we have conducted them, we would want to monitor those patients for 2-3 days before we let them go on their own. It becomes a bit difficult if somebody requires such an operation and they come on the last day when we are doing the last operation. It will deny us a chance to monitor them, and the worst case scenario is we might ask them to relocate to another center. Like now, those of us who are going to smaller facilities, we might ask them to come here. And yet, for some reason, this facility has been here all along, but those people have not managed to access it.
It's indeed a great pleasure to have you here in the Ankole region. The long-awaited camp, which has taken months to be done. I congratulate you and thank the Almighty for having enabled you to travel for over 4 to 5 hours. But luckily enough, the road is well done, no bumps like those which I hear you complain of in Kampala. At least here, the roads are well done, and you can take a picture of what happens elsewhere in Uganda. Indeed, I know you are coming to do tireless work, and for the next 5 or 6 days, I know you are going to spend the whole time standing up, and probably less sleeping hours for you. You will be fatigued because it's a continuous process day by day. There is no resting, and I know you will not leave any stone unturned. I head the Department of Surgery of Mbarara Regional Referral, and as you know, in our systems, the referral site coordinates all the lower facilities. So we shall stay at Mbarara Regional Referral to coordinate all the other facilities. Any cases which cannot be done at the lower facilities will be done at Mbarara Regional Referral. At Mbarara Referral, we believe and we know we shall conduct the most specialized conditions will be handled at the regional referral. But that's not to underestimate what is going to be done at the lower facilities. Okay? It's only if at all there is any complications, definitely it will be referred to the respective facilities. We have Mbarara Regional Referral and also KIU Teaching Hospital. Those will coordinate the very specialized, the kind of surgeries which will be done, which we expect to be done at Mbarara Regional Referral include neurosurgery, that is the brain and the spine. We shall have also the orthopedics. I'm an orthopedic surgeon, so I will definitely handle the bones. We expect to have ENT, ear, nose and throat. We shall have those of the eyes, ophthalmology. We shall have the pediatrics working on the very young children. Will be handled here, to mention but a few, the subspecialties. And I think everything is well organized. I really want to appreciate Honorable Batalingaya. He has indeed worked tirelessly hard with his team to see that they sponsor this camp in whichever way. Also our partners, the Ministry of Health, the different pharmaceutical companies, and everyone who has contributed. I know it is going to be a nice time for you. You know, it's two-way. You come to work, but also it doesn't prevent you from making a tour and see what happens in the western region or the Ankole region. You will see a lot of banana plantations. I know you eat matoke and you don't know where it comes from. No, because you are the one.
So while we are here,
The guests don't talk before